But I think, the physician assistant, this kind of gets into politics again, but, the amount there's not really a precursor to a physician assistant. The precursor to a nurse practitioner is a nurse. So a physician assistant, a lot of those are coming from a CNA role or from a medical scribe role, those sorts of practices, and they don't really have these big, powerful lobbying bodies behind them. So that's my opinion as to why it's lagged behind.
And I guess I'm curious, why is there full practice authority for physician assistants, which is another group of providers?
Yeah, it's lagged behind. Physician assistants do have a handful of states where they can have independent practice. And again, it goes back to, even if they're being supervised, how much supervision is that really? Is it like a review of 10% of patient charts? Or are they consulting on most cases, cases where they don't know things? It's a very, a very gray area. There's not any explicit guidelines for these sort of collaborative or supervising agreements. But I think, the physician assistant, this kind of gets into politics again, but, the amount there's not really a precursor to a physician assistant. The precursor to a nurse practitioner is a nurse. So a physician assistant, a lot of those are coming from a CNA role or from a medical scribe role, those sorts of practices, and they don't really have these big, powerful lobbying bodies behind them. So that's my opinion as to why it's lagged behind. Is that 100% correct? I really don't know. And that's sort of the argument for nurses and independent practice is, you've had these thousands of hours, I guess if I count overtime, I probably had, over 10,000 hours of clinical practice in a hospital, doing patient assessments and, being in a float pool like I was exposed to a lot of different pathology. It wasn't just taking care of patients after a specific kind of neurosurgery. That would be a very limited experience versus a float pool where you may be on cardiology one night, you may be on a renal and diabetic unit, then you may be on the orthopedic floor. So you really see and are exposed to a lot of different things. So that sort of a background I think is beneficial, and that 10,000 hours is not going to be equivalent. And there should be some sort of a floor that's set, I guess, for RNs going into these NP programs, where it's I think there are some programs out there where they don't require clinical experience, or it may be a very small amount. It may be something like a year or 2 years. And then again, it's a very heterogeneous 1 year, 2 years. You don't know where someone has been in their practice. So I don't know. Those are just some of my thoughts on, I guess, why the NPs, that movement has been more successful and the PAs have been less successful, because they're not necessarily doing, clinical exams as a scribe or as a CNA, medical assistant, those sorts of things.
Yeah, that makes a lot of sense. And then to the point, maybe 10,000 hours should be the limit. I mean, I guess I'm thinking of the Malcolm Gladwell book, Outliers, that looked at a bunch of different experts and how they became experts after 10,000 hours of use. I think his one of the examples was the Beatles. They played over 10,000 hours of shows in Holland at a after night club before they really came up in the UK. And by the time they were starting to play big shows in the UK, they were working well as a team because they had that 10,000 hours of experience. So maybe that is the threshold we should be trying to meet. And I should say a correction. I think the PAs changed their name from physician assistants to physician associates. And so maybe there is some lobbying push for them to get independent practice as well.
Yeah, I saw that. That's kind of interesting. And I can take it or leave it. I don't really care what a group of people calls themselves. But some physicians have had some interesting pushback here. I've mentioned this before on the podcast, but I think medical Twitter is a really funny, really interesting space. And some very disgruntled physicians, they're not associates. They're a level below us. They're called mid-level providers for a reason. It's if they voted to call themselves the Avengers, would you have to call them the Avengers? PAs, physician Avengers. But in any case, just having some good laughs there. So we've talked about, NPs and the lack of incentivizing primary care that are sort of tearing apart and destroying the medical establishment.